you have sensitized people. I've been at several of your seminars, haven't had the privilege of even moderating or emceeing and all that. What impact did you say all these have had, on women, especially women who are, battling breast cancer issues?
I must say we are grateful to God for how far He has brought us. We also want to thank the media. And Dave, you've been with us for these several years. We actually have received a lot of good feelings from the awareness that we've been creating. A lot of lives have been saved. But I must say we are not there yet.
Yeah.
We still have a lot of work to do. And it's not something we can say we are done. We are tired. We cannot be tired. And fighting for the cure it's a fight that is worth undertaking. We need to do that. We need to save the lives of a lot of our people. And so people should not be tired. And that's the reason why we always ask that more people should join us.
Yeah.
Because we can't do it alone. Yeah. We need all hands on deck.
So help me here. Do we have any kind of data, available? Let's say annually, roughly how many women, are diagnosed with cancer? How is treatment like? How is the survival rate like? Any data available that you can share?
Yeah, every country has its own data. But for those of us in the low and middle income countries, our data normally falls short. And so we have the data from GlobalCan. That's the cancer wing of the WHO. And that spells out the fact that in Ghana, annually, more than 5,000 women are diagnosed with breast cancer.
Every year?
Yes.
5,000?
Yes.
Every year?
Every year.
In
and
Ghana?
out of that, yes.
Wow.
Out of that, the mortality is even shocking. More than 2,300 women die from breast cancer every year.
So before the end of this year, 2025, more than 2,500 women would have died as a result of breast cancer?
Yes, yes.
Why is it so high? Is it because awareness is low, or, yes, I know there's no cure, but we don't have...
There's cure.
Cure or treatment?
Yes, there's cure, absolute cure for breast cancer.
So we'll get there. We'll talk about that.
Yeah.
So why do you think the numbers are that high, that about 2,500 out of the 5,000 infected women die every year?
Yes, so our problem is the fact that our women come late.
Okay.
When breast cancer is diagnosed at a late stage, the treatment is very difficult. Okay. Our breast cancers are different.
How different?
We, as black women, we have more triple negative type of breast cancer. Breast cancer has several subtypes, and the triple negative one is more aggressive. Okay. And so if we are reporting late, and we are the same people who have the more aggressive type, what do you expect? So for us to counter that trend, we have to do everything that it takes for us to diagnose the disease early and to take action promptly.
Why do people report late?
It's a lot of sociocultural and psychological beliefs. Breast cancer is not painful at the beginning.
It's not painful?
No. And so our people are used to going to the hospital when there's pain. So when even they found a problem in their breast and there's no pain, the thinking is that once there's no pain, there's no danger. And so they can afford to go about their normal duties. It's not going to kill them as an acute disease. And so they don't see the urgency of reporting. So by the time they have finished roaming all the prayer camps, drinking all the concoctions, applying all the herbs, and it dawns on them that no, things are going out of hands. So let me go to the hospital. By then, there's already metastasis.
But isn't that to suggest or say that once they move from one church to the other and go to one, traditional healer to the other, using all the concussions and all the things that they apply on it, doesn't this? It ought to tell us that education is a bit low, the sensitization is a bit low. They don't know the right things to do. Isn't that what it is?
Yes, we need a national drive. The same way we tackled HIV is the same way we tackled COVID-19. That is the kind of initiative that we should do as a country.
Why are we not doing it?
We, in the first place, we in the low and middle income countries, we don't see the non-communicable diseases as diseases of urgency or importance. So once it's not killing a lot of people at a go, they think that we have time. We can buy time. So what even the nation should do, because there are instances, there are experiences from the high-income countries. We don't need to reinvent the wheel. Why are we not learning what they are doing so that we can also, we can also take those steps that helps them to reduce the mortality rate.
Well, if you look at like 2,500 women die each year, that is a huge number.
Yes.
And it's still not pushing us to do what is needful.
You know how we normally take serious issues, like it's not serious, kind of. Look at where we are with Galamsey. That's a typical example. So that's how we've been, lackadaisical when it comes to the the NCDs. And cancers are killing a lot of people. Almost every family has been touched by one cancer or the other.
And when doctor mentions NCDs, it means non-communicable diseases. Doc, so at what stage in a woman's life should she be worried about breast cancer and do the checks and all that? But first of all, for the benefit of those who may not know what breast cancer is, what is breast cancer anyway?
Breast cancer is a cancer that starts from the breast tissue. So sometimes people confuse that with when there's metastasis. But when the disease is in the breast, that's abnormal multiplication of the breast tissue with the characteristics of spreading out of the primary source. That is a malignant issue. And so breast cancer is when the cancer is in the breast. But people should understand that it's not everything that appears in the breast that is malignant. There are so many diseases that can affect the breast. But we are always, worried about breast cancer because that's the one which can kill us. The others may not kill. So, and if it's the number one killer disease among women, as far as cancers are concerned, then you want to ask yourself, why are we not so serious about it? And it's partly because of our cultural beliefs, the fact that we think it's caused by witchcraft. And so everything is like, let's go and solve the witchcraft part, the spiritual part, before we go to the hospital. And that wastes a lot of time.
So at what stage in a woman's life should she be concerned about, breast cancer issues and start, the screening or the checks and stuff like that?
For us, black women, I advise that once the breasts are there, once the breasts have appeared, we should be checking. Because our youngest patient is a 13-year-old. She was diagnosed at the age of 13. And at the age of 13, she had to lose both breasts. She's 19 years this year.
She's lost both breasts?
Yes. That was the only way we could save her life. And she's in the senior high school now. So once the breasts are there, we should be conscious of it. And we should be checking them. Every woman should know how her breasts look like and how they feel like. Because if you don't know them, you can stay with a disease for several months and even years and not be aware that something is happening. And we women, we are always conscious about our breasts. We show off. The men also love them. It's good for the children. But when it's diseased, it can kill us.
But when you're screening or doing the checks, you're not just looking out for lumps. I realize that the discoloration of the breast, the nipple changes, some discharges can also be signs of a breast cancer. Am I right?
Yes.
So tell us more.
So the classical signs of breast cancer are normally late stage signs, like pudorage, like retracted nipple, like bloody discharge from the nipple, like dimpling in the skin covering the breast. These are all signs that whatever is happening in the breast may not be a benign condition. But we don't want people to wait for those signs. We don't want them to wait until there's pudorage on the breast, until you have some area of thickening or the whole breast is firm, or there's a change in size, so one breast has become so big, before you start looking for care. Because if you wait for those signs, by the time you go to the hospital, you might be dealing with a stage 4 disease where the cancer has already left the breast and is in the lungs or liver or the brain or the bones.
You've been talking in a lot of ways, so your voice is failing you. Forgive me for asking more questions. So you talk about stage 4. What are the stages? From 0 to what stage do we have?
0 to 4.
We have 0 to 4.
Yes.
So the 4 is the last stage.
The last stage. That means that the disease has spread somewhere. So maybe there's metastasis in the lungs, in the brain, in the bone, or in the liver.
Take a rest. Let me rest your voice for you. But what we're doing is this. We're not going to rush our conversations in any way. Because as much as possible, we're going to dedicate a lot of days in this month of October to give you education, to give you information, to sensitize you, and do so many things. We're not going to rush it. But one thing I just want to put out is this. For the woman who's listening to us right now, and Doc mentioned that once you have a breast, so to the girls, to the women, many a time we take certain things lightly up until it hits us. And, so when